inform you of the main reason for the use of Cpap breathing machines in the home setting. That reason is sleep apnea. We will discuss the types of sleep apnea, the diagnosis of sleep apnea, and the treatment of sleep apnea. The word apnea is a Latin word that means a suspension of breathing. Sleep apnea is a medical condition in which a person stops breathing in their sleep. Cpap breathing machines work to correct these apneic spells in patients with sleep apnea and help them to sleep more comfortably. I have some handouts today that show you normal airflow versus a blocked airway. We're also going to demonstrate a Cpap machine today. This is a nose piece. There are also full face masks and also a mask that covers just the mouth. There are different settings. This one is set on a pressure of 8. There are two types of sleep apnea, central and obstructive. Central sleep apnea is caused by a temporary lack of communication between the brain and the respiratory muscles. Obstructive sleep apnea is caused by an obstruction in the airway, usually when your tongue falls back into the back of your throat during your sleep and blocks your airway. In order to diagnose sleep apnea, a sleep study is performed in a controlled environment under the supervision of a respiratory therapist. The patient is hooked up to an EEG, which monitors their brain activity during the sleep study. This also aids in diagnosing central versus obstructive sleep apnea. If there is no abnormal brain activity, then the reason would be obstructive. Everyone experiences some small periods of apnea in a normal night's sleep. In order to be classified as a true apneic episode, it must last longer than 20 seconds. Cpap is the main treatment for sleep apnea. Central sleep apnea can be treated by medication that helps the brain to function normally, and Cpap is used in some of those cases as well, just to aid in easing the breathing and making it more comfortable. But Cpap is the most effective and only treatment for obstructive sleep apnea. It works by applying continuous positive airway pressure to the airways, which serves as a type of stent to open up the airways from whatever is obstructing it, which is usually the tongue. You can see as the air goes in here, it creates a positive pressure which pushes the tongue back toward the front of the mouth and allows the air to flow back into the back of the throat. In conclusion, we discussed the two different types of sleep apnea, central and obstructive, how sleep apnea is diagnosed by sleep study and by the patient having sessions of breathing lasting 20 seconds or longer, and finally, how Cpap aids in the treatment of sleep apnea by providing continuous positive airway pressure to the airways. Thank you.